Shall we start?
Yeah, okay, Sujata, we'll start.
Oh, yeah.
Good evening, everyone. On behalf of SAR Foundation, I would like to welcome you all and friends who have logged in from different time zones for today's session. I'm Dr. Shanti Priya, a young onset Parkinson's warrior and founder of SAR Foundation, which is to make a difference in the life of a person with Parkinson's to lead a better quality of life through holistic approach. In the past few months, the world has come to a virtual standstill as the SARS-CoV-2 virus continues to spread across the globe. Many countries have taken drastic measures to curtail the infection, which include social distancing and in some countries, a complete lockdown of social and economic life. In India, we survived lockdown 1 and 2, and we are in the midway of lockdown 3. And this is not going to end anywhere in the near future. COVID-19 pandemic has profoundly changed people's normal routine. And this happened over a short period of time. And such drastic changes require a flexible adaptation to new circumstances or situations, which is a cognitive operation. And that depends on a normal dopaminergic function, which we people with Parkinson's do lack. So that as a part of a Parkinson's community, that gets me thinking, are we at risk? How do we manage our symptoms, which seems to worsen during the stress, because of the stress of isolation and physical immobility? Whether a regular neuro consultation is safe at these times? And how do we manage stress and anxiety during the lockdown? So I welcome our two distinguished speakers, both leading doctors from Chennai, Dr. Bhuvaneshwari, a consultant neurologist, Kaveri Hospital, and Dr. Sujata, a consultant psychiatrist from Kaveri Hospital. I thank you both for joining us today. We will be answering the questions at the end of both the sessions. You can either type the questions in the question answer box, and if time permits, you can raise a hand and we can you can directly ask the panelists your questions. So now I request Dr. Bhuvaneshwari to talk on COVID-19 and its effects on Parkinson's and how we manage them. Over to you, Dr. Bhuvaneshwari.
First of all, thank you so much, Dr. Shanti Priya, for organizing this meet, because it's very important that we reach out to people with Parkinson's disease and tell them the effect of the pandemic and also the lockdown, what kind of impact it's having on our lives. Because sometimes lack of information or overload of information is what we get. And we need to assimilate that information and do things right. See, Parkinson's disease, as we know, brings about very important features such as bradykinesia, the rigidity, and the tremors. And these are called the motor symptoms. And then we also have the non-motor symptoms, like, your abdominal symptoms, constipation, feeling of fullness, sleep disturbances, REM behavioral sleep problems, vivid dreams, postural hypotension because of autonomic neuropathy involvement. So you have various non-motor symptoms of Parkinson's disease. Now, when it comes to COVID and Parkinson's disease, see, Parkinson's patient per se is not directly more vulnerable than another patient to COVID. Although there have been some studies where they've looked upon the receptors, the ACE receptors and the dopamine channels, whether they are making it more vulnerable, making these patients more at risk to get COVID. But studies have not really substantiated that. But however, we must understand that most of our Parkinson's patients, the sporadic Parkinson's disease patients, are elderly population. So as such, because of the age and other comorbidities. They could be diabetic, they could be hypertensive, they could be having a cardiac problem. So with all these background medical problems and the age, the patients are definitely more vulnerable to getting COVID infection. And also the impact of the infection on these patients is a little more serious than what it would be for a younger patient. And they've also shown that patients who have had invasive treatments like, DBS, or if they are on the infusion pump, dopamine, those patients are also at a slightly higher risk, and the mortality of infection is definitely a little bit more in these patients. So being careful, following responsible social distancing, trying to, if you are a carer for your Parkinson's, parents who have Parkinson's disease, making sure that they are kept safe, away from people who could be infecting them, making sure they're not it is not complete social isolation. That's very important, because we are not talking about social isolation, we're talking about responsible social distancing, more as a measure to keep them safe. If they have carers, we have to make sure that the carers are also healthy, they do not have infections, making sure they are not at risk of transmitting infections to these patients. So all these things we need to keep in mind. And from my experience during the lockdown, what I find, and when I talk to my patients, the main problems have been not just, problems have been procurement of medicines, because some people have been very, what do you say, prepared for this situation, and they bought medicines in advance. But many people have not done that. And so there is always this stress that they are not having enough medicines during the lockdown period, whether they would run out of medicines. So that is one problem. Second is, when patients have carers, the families are afraid, exposing these patients to possible infection and transmission, how to keep them safe. That's another problem that they're coming to me with. And third, the lack of exercises. See, most of these patients who are used to physical activity, their physiotherapy on a regular basis, that's completely cut off, and the physiotherapists are not able to reach these patients. So they are complaining that the physical activity has completely come down, and that's definitely affecting their motor function. And finally, a lot of non-motor problems like constipation, dyspepsia, always feeling that there is indigestion. They're having problems like dizziness because of orthostatic hypotension. And of course, there is a sleep-related problems. They get vivid dreams because of the stress. I think Dr. Sujata will be talking, she'll be focusing on the anxiety part of this whole pandemic, how it has caused a lot of anxiety in the patients. But these are the main problems that patients are approaching me with. So I think most important is it has taught us a lesson as to how prepared we need to be in terms of procuring medicines. I think that is very important. We need to have contact with a local pharmacy, a provider who can give us regular supply of medicines, making sure we don't run out of medicines. That is very, very important. Number two, whatever physical activity that you can do, please continue doing, so that there is no lethargy setting in, because fatigue is another major problem that these patients complain of. And of course, eating the right kind of diet, so that you do not have these abdominal symptoms and constipation, and taking the right medication. And we doctors are accessible through these online platforms and through our switchboards. Sometimes on emergencies, we do see them in person if necessary. So we are available. So if you have something very pressing and you need to talk to a doctor, do not hesitate. Please get in touch. So this is what I would tell to the Parkinson's patients during this period in particular?
So thank you for the valuable information. And nowadays we have all these online classes. So everyone is doing online exercises. So I would suggest online classes. And
Absolutely.
yeah, and maybe more telemedicine, so that because the virtual doctor patients, that even if you have more portals, that will be helpful.
Absolutely. I totally agree with you.
And I have one question to you. Some of us take amantadine for dyskinesia. That is an antiviral. Will that protect us?
Amantadine was first introduced as an anti-influenza medicine, but I don't think it stayed that way. It has never been proven to be a effective antiviral medication. But during the usage of amantadine, they found that amantadine is not just useful for the dyskinesia, but it's also very useful for fatigue, treatment of fatigue. If you look at Parkinson's patient, even multiple sclerosis patients, fatigue is a major problem that patients complain of. And for that, amantadine is very, very useful. So amantadine usage in Parkinson's is for dyskinesia as well as fatigue. It's very useful for fatigue.
Okay. And now, as our motor symptoms worsen because of stress, some people misuse their medication. They take extra doses and all. So what do you advise?
I mean, seriously, I think we need to be very sensible here. Your regular medication, you've already consulted your doctor and you have kind of a schedule schedule to be followed. And medication, most of the times we give them specific timings for each of the medication. So when we give you a schedule like that, please stick to the schedule. Okay. And if you think you have motor fluctuations, or if you feel that there is dyskinesia, please discuss with your doctors and make the changes. Because what happens is, not just self-medication, but changing these kind of medications and making alterations may sometimes lead to major problems, and it becomes very it becomes more difficult to treat later. So I would suggest that simple alterations are okay. You can be sensible and do it, but major alterations, please try and consult your doctor and do it.
Thank you. Now I request Dr. Sujata to help us fight stress and anxiety during lockdown.
Thank you, Dr. Shanti Priya, for this wonderful opportunity to reaching out to many people and the caregivers with Parkinson's. Now, during maintaining emotional health during this time, especially this COVID-19 time, is very important. And the thing is that in this month of May is National Mental Health Awareness Month in the United States. And so now coming to patients with Parkinson's, generally we see that the overall symptoms kind of increases a little bit, at least during stress. But we all need to know that stress is inevitable in our life. And what is stress is that it is a reaction to an external situation when we feel that it goes beyond our control. So now, how do we address this issue is the key thing. The main thing is that anxiety and depression, a little bit of depression, and these are called the hidden sorrows in Parkinson's patients. And these hidden sorrows, they come under, I would say, the non-motor symptoms. They kind of fluctuate throughout the day, and sometimes it even increases more during the off period also. And of all the symptoms in particular, tremor is something that you notice that it increases during the stressful period. And the solution to that is not to tamper with the medication. When I say tamper, increase or decrease the medication, but however, find ways to deal with it and cope with it, cope with the stressful situation or the stressful triggering factor. Here now, the relationship between anxiety or depression, or I would put it as a general term, the emotional symptoms, and Parkinson's disease is more relevant right now in this current situation. It has become relevant. And people with Parkinson's, if you see, they have, at some point, they would have already experienced this. But now it has become even more challenging because of all this isolation and restrictions. So one is anxiety and depression. The second point is social distancing. Me as a mental health professional, I would slightly want to tweak that word, which I will talk about it later. But this, as of now, let me talk about it as social distancing is something which is making a lot of people feel lonely and isolated, and that includes even caregivers. And not only that, because caregivers are now playing multiple roles because of the lack of domestic help. It's not just the role of a caregiver. And the third point is reduction in the physical activity. And fourth is sleeplessness, which seems to be, or sleep disturbance, as Dr. Bhuwana stressed, that is really causing a lot of issues, and constipation. And another thing which we are noticing is that there is this constant fear about ill health, not just fear of ill health in us, that is, I mean, those with Parkinson's disease, but also fear of their loved ones, fear of illness in their loved ones. This is kind of giving a constant worry to them. And some of the worries which we are noticing is that some particular concerns. What if I get some issues that I will have to be rushed to the ER? And am I prone for infection? So what do I do then? And what if the battery of the DBS, kind of goes away? And what about my health aid? They keep coming in and going out. So what is the risk of infection? Now, these are totally valid concerns. So what I would say is that do not hesitate to reach out to your treating team and allay all your fears. These are all very valid concerns. Now, how do you go about managing it, and how do you go about finding ways to be kind to yourself? Is that these hidden sorrows can be dealt with very well. One is that plan ahead and try to do your task in the way you have to complete it. So planning ahead is very important so that you don't do it in a hurry and get stressed. Second is that music. I can't stress the importance of music and what role it plays in our daily life, especially in situations like this. Be it sleep, be it relief of anxiety, be it even general apathy and lethargic feeling. There are some beautiful ragas. Like for sleep, it is those who are familiar with Carnatic music, there's something called the Neelambari Ragam. And then in Akbar's days, it dates back to music therapy, goes back to Akbar's days, wherein there is this rag called the Darbari Rag, where it was said that Tansen used to play this rag. This is a late night rag where Akbar comes home. It is used to alleviate his anxiety and tiredness. And another one thing, raga, which is found to be very, very effective, they say, music therapists say, is that kapi and kedaram. So, like that, there are multiple ragas, and music plays a very major role. And humor. Humor is so good. Even generally for us, those who are not stressed out every day, you just watch something humorous, it kind of lightens your heart. And I would tell all of them who are now, at home, we are all within the four walls, find ways to go back to those days of mind your language and here is Lucy, and then now the Big Bang Theory. And then in Tamil, I would say, there is this black and white movie called Sopu Sipu Kannadi. I don't think not many of them of our generation know. Anytime you just watch that, it just kind of lightens our heart. So find ways to bring about humor into one's life. And another thing I would say is that socialize. Now, one might ask, how do I go about socializing when you're saying social distancing? And that's where when I said, instead of really practicing social distancing, practice physical distance. But don't do that social distancing, wherein I would say avoid social distancing by reconnecting with your friends, reconnecting with your family, and also your fellow friends who are going through the same condition, it is the Parkinsons. And give them the gift of conversation to your fellow friends who are going through this. There is nothing like, talk. And that in turn will make other people also open up and talk. That's a very important thing. So practice physical distancing, but don't shy away socially. So socialize through any media or just pick up the phone and talk. And then exercise is so important, so important. And there are ways now, either yoga, Tai Chi, Pilates, and sometimes high intensity endurance exercise. But before getting into any exercise, please discuss with your neurologist or your treating physician as to what would be good for them, or how do they go about, which one will be better. And another thing I would say is that restrict this media, the news coverage, because everywhere it is just talk about COVID, Corona. That to an extent, even my 2-year-old says, monster Corona is outside, don't go out, mommy. So it has instilled that kind of a fear. So what I would say is restrict. Now we all know what Corona does, what it is doing, and probably what it will do. That's, I think, is more than enough. So kind of lighten yourself and distance yourself away from this Corona news. And another thing which I would also say is that some might be involved in a support group. They would have been involved in support group. But now it's not like practically you have to avoid going there. You can reach out to them by, again, calling them up and connecting with all the members who are in that support group. And take help when offered and when required. When help is offered, please don't hesitate to say a no. Please do that. And again, another one thing I would say is that, which is very important, is that daily routine. Establish a daily routine, because that helps you to be focused and also be motivated. That is very important. And fresh air. Fresh air is so important. We don't have to go outside on the road. Just go out to the patio, your balcony, or if you are in a single family home, just stay within the portico. Fresh air. Spend at least half an hour in the fresh air outside. That is so important. And by doing all this, especially this is called the lifestyle challenges. But if you feel that it is beyond your control by doing all this, then please reach out to your team, your treating team. Especially most of the neurologists are so empathetic, and they really understand what emotional toll Parkinson's takes at some times, especially during this time. And they offer a lot of solutions. So liaise with your team, and that itself is more than enough. But sometimes medications are required, and there are medications which do a great job. And that again, only if required. And that's when the neurologist the physicians and the mental health professional, they liaise with each other always and talk about how to go about with the medication. That is only if required. Now, a very little message I would like to give for the caregivers. Equally important is your emotional health also of the caregivers. Need to understand that you need to mind your mind in order to mind your fellow loved one's mind. So please be aware that for this, you need to build resilience because you have multiple roles to play and you have challenging roles to play. And so you need to build resilience. And in order to have a meaningful relationship, not just with others, but within yourself, you need to be also emotionally healthy. And for that, you can also, as caregivers, can also practice what I just mentioned a little bit. The most important thing I would like to is that there might be times when, they will go through anger and irritability. And I don't want you to take that as something which you feel is a sign of weakness. It is a sign that you are human. So do not hesitate to even acknowledge that feeling. And if you're going through anger, irritability, then that means it is normal. You are human. Just step aside, take some deep breath, relax, and then come back to address those issues. And don't hesitate to reach out to fellow caregivers because each one can help each other. In fact, you don't even have to go to a health professional. Fellow caregivers we learn so much from them. So reach out, don't hesitate to reach out and take some time off from your normal routine duty as a caregiver and do things which you really enjoy or which also matters to you. By doing all this, you not only help yourself to take your life to the next level, but you also are helping to take your loved one's life to the next level and be more meaningful to it.
Thank you so much, Doctor. It was really wonderful information to all of us. I would like to add even art therapy.
Oh, yes. Yeah.
Because that is also like something like a meditation. And
yeah.
So that because I do a lot of art, so I just get engrossed in the art and it's like a meditation for myself. And after that, all whatever the anxiety, stress, everything is it just goes away.
Yeah.
So actually in our support group, we motivate our members to whatever to follow their passion. So one will write a poetry, one will draw, one will paint, and it's like that. One bake and she put a picture. So it's like that we motivate them to do all the things which they like.
In fact, I would actually add on to say that every single one of us, it's not whether you're a patient or not. It's not about that. All of us should have a hobby. We should all pursue a hobby, because not just for these very challenging times, because this is not something that anybody anticipated. This has come out of blue and the whole world has been taken by storm. But even on a normal day or normal times, I think all of us should have a hobby to follow, because that gives you so much of inner peace. In fact, I tell this to all my patients, whether it's Parkinson's or stroke patients or dementia patients or the carers. I always say all of us should have a hobby, because it distracts our mind, number one. It gives you an inner peace, like what you said. When you do something so engrossing, your focus is completely drawn to it, and you start thinking more about that, and you don't think about all the other things which is stressing you out. So it's very important that all of us have a passion or a hobby which we need to follow. And I think we should stress this to every single person, not just patients or carers, I think every one of us.
And there's a study that says that art therapy improves the motor symptoms also in Parkinson's, and it delays the progression of the disease also. And I say that when you said music, I said even you can put some music and just dance in your room.
Yeah.
Whatever.
Yeah.
That also is like a let out, and that also actually delays the progression and reduces your non-motor symptoms.
That's true, isn't it, Shanti? Because when you look at these support groups, they promote dancing to improve your balance, you know, because we are always teaching Parkinson's patients to improve their balance and their gait stability. And some of these ballroom dances, right, they actually are involving a lot of grace and balance. So when you're actually dancing, it improves your balance. It's more like an exercise, and it becomes an enjoyable exercise.
Yeah, especially tango. But unfortunately, in South India or in India, we don't have classes for tango.
Oh, okay.
I think any dance, except for maybe Dappangutu or something like that. Even if you do well, perhaps you can.
Yeah, yeah.
But actually, we end our support groups meeting with always with a dance.
That's good.
Oh, that's nice.
That's nice. Yeah, that's actually good.
So, I have a few questions. Some cough medications react with monoamine oxidase inhibitors like reserglin and Reselac, like dextromethorphan, phenylephrine. So, what do we take at that time? Because cough is one of the symptoms in COVID.
That's true. But actually, if you talk to the pulmonologist or even the physicians, most of the cough medicines which were being followed, as you know, were taken off the shelf because they found that they were not useful at all. So many of the cough medicines that are given should be taken with caution. Not all cough medicines are really useful. Simple things like gargling and drinking warm water will be more helpful than taking medications that can make you sedated as well, because some of these medications do have that can make you a bit groggy. So you have to be careful when you're taking these medications. It's not just the interaction, but it's also can make you groggy, and you don't want to be losing balance because you're a bit groggy. So you have to be careful about that.
We have a question from Mr. T.S. Shankaranarayanan. I'm taking amantadine 100 milligrams once daily for 6 years. I'm 77 and have PD for 7 years. What will be the side effects from now on?
Amantadine, like many of these Parkinson's medication, what happens is it can increase hallucinations. So if someone is prone to hallucinations, when we try and optimize medication and reduce medication, we also look at reducing the dose of amantadine. Except for the hallucination part, most of the time amantadine is well tolerated. It doesn't cause much of an interaction with other drugs also. But when patients start to have visual hallucinations or severe sleep related problems and behavioral issues, that is when we start thinking about reducing the doses of amantadine along with the other dopamine agonist and also the dopamine drugs, because all these medications can actually increase visual hallucinations, any hallucination, whether it's auditory or visual, which can happen per se in Parkinson's disease towards the later stages. But these medications also have a tendency to increase them. So you have to be careful and you have to reach a balance. And when that happens, you start reducing the medication so that you optimize it, which is suited for this particular patient. You have to individualize the treatment there.
I have a question. Now, in COVID, pneumonia is the cause of death. And even in Parkinson's, mostly it is pneumonia. So will pneumonia vaccine help in elderly patients?
Okay. See, basically, pneumonia vaccines are helpful for all elderly patients, right? However, this particular virus is a different strain of virus. It's not the usual influenza virus for which we take the vaccine. Now, this is a coronavirus, SARS coronavirus, which is a respiratory syncytial virus. That's what they call it, an RNA-based virus. So, in particular, your pneumonia vaccine doesn't really work for this, because what you take as a flu jab or a pneumococcal vaccine, pneumococcus for the bacteria, doesn't really work for this particular virus. So in general, by taking it now, it offers no extra protection.
And now if a Parkinson's patient is ventilated and most of the drugs are by oral, so how do you
we always I say to doctors in ICU, when Parkinson's patients are brought into a hospital, whether it's a ward or ICU, depending on their conscious level and their clinical state, we decide whether this patient is at risk of aspiration, whether is he conscious, is he able to swallow well, is he able to take his medication well. In case orally is not able to take medications, then it's absolutely essential that you put a Ryle's tube as soon as the patient gets into hospital. Because you rightly said, all the Parkinson drugs are oral drugs. So you have to make sure there is no break in their schedule of medication. So when they come for any illness into the hospital, what it takes is to continue the medication that they take for Parkinson's. That should not be stopped.
And because of the stress and anxiety, are you and sometimes they say that the latent forms of Parkinson's, are you seeing more number of newly diagnosed Parkinson's patients at your clinic?
Okay, that is the problem. See, what is happening is not just Parkinson's patients. What has happened with this lockdown and the fear that has set in, it is so deeply ingrained. People are so morbidly scared of coming to a hospital or reaching out to a doctor. Forget about coming to a hospital, even reaching out to a doctor. So sometimes what I'm seeing nowadays, in the last 1 month, I've seen a lot of emergencies. I go to the hospital for emergencies. I'm seeing a lot of strokes. I am seeing late presentations of conditions like myasthenia, optic neuritis, where they must come early, but they're coming a bit late. So I feel when there is a problem, patients, because of the fear of going to a hospital or reaching out to a doctor, are not seeking medical help early. I think that is something that we must really address and tell everyone. If there is a problem, if something is not right with you, please seek medical help. There are doctors, as I said, we are telemedicine. We were having our reservations about telemedicine, all of us. Now, this is a situation which is not only helpful for the patients, but it's also conditioning us to the technology. We are also embracing technology. We are also understanding that we can use technology wisely and reach out to our patients in the right time. So please do not hesitate to seek medical help. There are lots of portals where you can reach out to your doctor, including hospitals. They set up these online consultations. So please use these facilities.
I have a question from Mr. Syed Usman. I'm taking Zolfresh 5 milligrams during the night time for sleep. Now I've started taking during the daytime at 4 p.m. after consulting with my doctor, as this drug helps to release my stiffness. He's taking at 4 yeah.
Zolpidem for stiffness. I'm not sure whether that's really going to help for the stiffness. maybe it will bring in a bit of, relaxation in you, because, it's kind of getting you into a nice, relaxed frame of mind. So it's that way it might help. But zolpidem being used as a anti-stiffness medication, I'm not very sure how that helps. But maybe because it makes you more relaxed and you feel less stiff. What do you feel, Dr. Sujata?
Yeah, perfect. Yeah, that's what even I feel. Probably it just, as I said, that some of the symptoms, most of the symptoms during stressful period, it increases. Not just tremors. Yes, tremors, it's quite obvious, but even stiffness increases. And by taking zolpidem, as Dr. Bhuvneshwari just said, probably it's bringing you to a relaxed state of mind, and in turn, it's giving you that impression that yes. So that means that stiffness is related to some stress. And probably you could explore further, Mr. Syed, as to is there any stress that is triggering this stiffness. But per se, zolpidem, that is Zolfresh, is not an anti-stiffness medication.
So, because sleep is always a problem for people with Parkinson's. So, even for me, even with any medication, I sleep, but maximum I sleep for 4 to 5 hours. But that 4 to 5 hours will be quality sleep. So, is that 4 to 5 hours enough?
Okay. I think, see, when it comes to sleep requirement, right? Normally they say a young adult or a adult will require at least 6 to 7 hours of sleep. Okay. But that is not a general rule for everyone. It also depends on the kind of activity that you indulge in during the daytime. For example, if you are going to work, you're fully, absorbed in work, a lot of physical exertion, driving to work, negotiating the traffic. So when you come back home, you're really tired. So you automatically, when you fall asleep, you get to that, you try and get that 6 to 7 hours of sleep. However, now during lockdown, that physical activity is definitely lowered for everyone. So, and also many of the times there is a small afternoon nap that happens in most houses. Okay. So with all this, expecting us to sleep for the same amount of time in the night may not happen. The body doesn't require. So you may either get up early, or you may not sleep immediately when you get to bed. Okay. And the other things that I also notice is, because we are always at home, we expose ourselves to a lot of artificial light. People working from home, watching television, kids, everybody at home. So that also alters our sleep wake cycles. So our sleep wake cycles are disturbed, and we are sleeping late. Most of us are sleeping late. I think that is like what Dr. Sujata was saying earlier. It's absolutely essential for us to maintain a routine. Even during this time, as much as possible, please maintain a routine, especially with sleep, not just the elderly patients or patients with Parkinson's disease. I think this has to be a dictum for everyone, including children, because when they are going to find it very difficult when they get back to their schools and colleges. So it has to be a dictum that we follow in every house.
Yeah, that's true. With all this Netflix and Amazon Prime movies, so it's just going haywire everywhere.
Yeah, just my, sorry, Dr. Shanti. Now, again, I noticed that a lot of people say they sleep for about 5 hours, good quality sleep, and they wake up. What happens is that they are just lying down, and and the thought process is like, I'm not getting sleep, I'm not getting sleep. That in turn induces stress. They toss and turn, and that induces a lot of other cognitive issues and in turn anxiety. So what I would suggest to such people is that it's okay. 5 hours of good sleep, and as Dr. Bhuvneshwari just said, it's just that our routine has gone haywire now a little bit, and even otherwise, that 5 hours of quality sleep is fine. So if you are awake, just lie down, and you can do some deep relaxation exercise, like in yoga they call it pranayama, or it's just that taking you deep inhale through your nose very slowly, pause for 5 seconds, and then exhale very slowly and come to a relaxation state, and just keep doing this. And while doing this, be mindful of what you're doing, in the sense you be mindful of the breathing and the relaxation state. And some people and report to us saying that by doing that, they didn't know when they fell asleep again. And another thing is, probably we don't have time now to demonstrate that. There is something called the visual guided imagery. This is generally for anyone, and people with Parkinson's can also practice this. All they have to do is just think of a situation which they find very relaxing, like by the beach, a very nice beach, not the crowded Marina or a Besant Nagar beach, but a very nice beach which is secluded. Imagine, let your imaginations run wild, wherein on one side it's lush green hills, and on the other side it's just this calm beach with only 3 or 4 families running around. And at that time, visualize, put yourself in that place, feel the sand, feel the wet sand, feel the waves touching your feet, and feel the wind blowing on your face. Hear the birds chirping, and just take yourself into that relaxed state. And this gives a lot of relaxation. And again, there are people, by doing this, they drift into sleep. So just relax yourself, instead of saying, my God, I lost my sleep, and then toss and turn and activate yourself further. And that takes away even that little sleep which you are having. So this is something which all can practice.
That's a very good suggestion. Another question from Mrs. Sapna. How do I manage dyskinesia when the tablets don't work? Which tablet to take as SOS?
I think for dyskinesia, it's not an SOS tablet. Okay, I would really like you to talk to your doctor, because the reason is the dyskinesia could be because you're taking too much of dopamine. Okay, you may want to reschedule your medication so that you're taking less of dopamine, or reduce some of the dopamine agonist medications so that the dyskinesia is not very prominent. Especially if you're being treated for a longer time, you know that you are more dyskinesious because of the treatment, which is side effect. And also use of amantadines and other medications will be important. So please, I would suggest, there is no SOS medication here. I would really think about how to address this problem as a long-term solution and talk to your doctor.
So in Parkinson's, patients can undergo ventilation. I forgot to ask that when I was asking the other question. Or there's no.
They can, but as you know, it's all elderly patients.
Yeah.
When they get into ventilation, it's always a difficulty of how much the lungs are affected and how stiff the lungs are. And also, some of these patients may have other comorbidities. So extubation, even when they're getting better, because the lungs are so stiff and because of lack of activity, there is something called atelectasis. So the basal parts of the lungs are not able to contract and expand as much as they should be doing because of the lack of activity, especially later stages of Parkinson's. If they're bed bound, then it is absolutely essential that we should try and assess this condition first, because ventilation, when you're trying to take them off ventilator, it is more challenging than for other patients.
Just one more question. Some dopamine agonists like Pramipex causes the compulsive disorders. Are you seeing now, because of the more of social media and all, are you seeing more of these behaviors in your patients? Because gaming, all that has become more now.
I'm not able to put it down just to this drug, but I think the obsessiveness in general has increased in almost everybody. I think we are obsessed about, especially, like what Sujata was saying, we are obsessed with these COVID numbers also. I mean, whether we want it, whether that's really essential for us or not, we're all listening to how many people have been affected, how many people are dead, how many people. I mean, I think information is vital, but let's not overload us with information. Yeah. And also, we need to be in a frame of mind how to assimilate this information. When you're not able to do that, it's best to take in just what is required. And do not, expose yourself to too much of this. Especially now, the media is all about COVID, and so there's a lot of obsessiveness. Even, like what you were saying about medication, whether it's enough, am I being on the right medication? They're so anxious about something that they've been doing for a very long time. Who is going to be looking after me? Can I reach a doctor? What will happen? Those kind of questions are always there. But as I said, you're having a family, you're not isolated. There is no social isolation. There is only physical distancing. There are family members, there are support groups, support groups like yours, doctors, medical personnel who are all available to reach out. Please reach out in time. Do not hesitate.
And all of us are now obsessed with hand sanitizing. Now even buying vegetables, people are scared to get because of this Coimbatore issue. All that is actually causing a lot of stress.
So you don't need Pramiprexol for that. It's there.
Because that is the most commonest drug for...
Yeah, that is true. But it's not just that. I think people are obsessed about a lot of things right now. Yeah. Relax.
So you're not seeing any newly diagnosed patients?
I came across 2 patients during this time who reached out, and we started them on medication. But as I said, that's only 2 patients. Otherwise, you would see more patients, right? So I think that's important, that if you think something is not right with your mobility, you're a bit slower than what you are, more stiffness in your arms and legs, think. So patients should talk to their family doctors, even approach your family doctors. They will guide you. They will tell you what to do. You may not need a neurologist straight away. Your family doctor is your best, your first approach. You should be your first port of help, So don't hesitate. Please seek medical help.
We don't have any more questions. Any take-home messages from both of you?
Okay. I think most important is do not miss medication. That's very, very important. Make sure you have enough medication with you. And if you're having any changes in your symptoms or signs, motor fluctuations or dyskinesias or hallucinations, please get in touch with your medical team. Even if you're not able to reach your neurologist, you should be having a family doctor. He'll be able to guide you. So seek advice at the right time. And I think following a routine, including an exercise pattern every day, doing things to relax us, exposing ourselves to less media, and getting in touch with family members and friends, I think that's what will keep us cheerful, will keep us healthy during this time.
One question we have for you. Mr. Vasudevan wants to know what is burning mouth syndrome.
Okay. See, burning mouth syndrome can be an autonomic problem. What happens is when you take some of these medications, you do have that feeling of dryness in the mouth. With some of these dopamine agonists and dopamine drugs, when you take, you feel as if your mouth is very dry. And when you have together with the autonomic involvement, there is this burning mouth syndrome that can happen. And we make adjustments to the medication, or we even tell them to take little chocolate or little things to kind of keep them to chew something on, so that the mouth doesn't get dry. And uh, we try and avoid medication as such, maybe some multivitamins, but otherwise we just tell them, because the mouth is so dry, try not to keep it dry. Use little say mint or something like that, a non-sugar coated, if you're a diabetic, a mint or something, so that your mouth is not allowed to become very dry and get to the stage of burning.
Thank you. So, Dr. Sujata, your take-home message.
I think the take-home message at this time, the COVID situation time, will be that I think we should focus more on what is within our control rather than focus what is out of our control, and try to practice whatever we had discussed now in this past 1 hour, and go about building emotional resilience. And that's what is going to help us, not just now, but from now onwards. Probably this is a time that we are beginning to learn a lot of things which we took a bit lightly. And if you practice all this, I think it would lead to a lot of emotional resilience and be able to meet the challenges, be it physically or emotionally. And we can all learn to help also others to mind their mind. And never hesitate to reach out to the treating team.
We have one more question. Can lips swell due to Parkinson's?
I don't think so. But the lip stiffness can happen along with what we were talking earlier, the burning mouth syndrome. Some people even say there is some kind of lip stiffness like feeling that can happen. But as I said, there's a lot of debate as to whether it is lack of dopamine, or is it the dopamine itself giving you the symptoms. So we have to sometimes just titrate medications, and think about other methods, non-pharmaceutical ways to improve the symptoms. But lip swelling, not really. Not. It's more that it's part of that spectrum of the burning mouth syndrome.
We have another question from Mr. Sundar. He's a YOPD. How long it takes to progress to the last stage? That depends from patient to patient.
And there is no single rule dictum that can be applied to the population. Each and every patient is different. And in fact, if you look at their medication, how they're taking their medication, what kind of treatment they're going through, although the drugs might be same, some of the way they're taking it, the number of times, everything varies. So you cannot say, predict these things. Based on your signs and symptoms, we sometimes talk to the patients about how much they are progressing as doctors when we see them on a regular basis. But on the first note, it is impossible to predict. Unless you have something like a Parkinson's plus conditions, like a MSA or multisystem atrophy or a supranuclear palsies, which are more serious types of Parkinson's. Most of the sporadic idiopathic Parkinson's disease, the progression rate varies.
And even in young onset, it's actually slower than the older age.
Yeah, absolutely.
And if you are active, I feel you can delay the progression too.
True. Absolutely. Absolutely.
We don't have any more questions. So thank you, doctors, for giving your valuable time for us. And I thank you all for attending today's session. See you soon with another topic. Until then, stay home, stay safe. Let Parkinson's never define us. Let us all shake off and move on. Thank you.
Thank you.
Thank you.
This
Bye.
is my tagline. Thank you so much.
Thank you.